Welcome to Pacer Nursing Power Hour, your go-to spot for real talk and real tips in the world of nursing.
So plug in, scrub up, and let's go. This is Pacer Nursing Power Hour where students get powered up.
Love it. Always good.
Okay, so today's episode is called So You Passed NCLEX. Now What? And we are so excited to welcome one of our alumni, Gaby Hoover.
Yay!
She graduated
Whoop,
in
whoop, whoop.
May of 24. No,
I graduated in December.
December of
December
24. That's right. I knew it was
So we're coming up on a year.
Yes. Soon.
So exciting.
all right. So she's going to talk about life after the classroom.
So you've swapped red scrubs for real world scrubs, and you're here to share the honest truth about stepping into the world of nursing. I'm super excited to meet you. Kennedy has talked you up.
Listen,
I've been trying to imagine you, what you look like, because she's
Oh,
just
Lord.
said so many good things about you.
Okay. So the first time we kind of connected, it was even before Peds, remember?
Oh, Lord. I don't.
Because I was
She's like, that's a blur.
I was doing orientation during the summer. No, you were in my summer clinic.
Yeah.
And you were president for SNA.
Yes.
And so she would
Wow.
show up and do the orientation sessions with them. That's how I learned
You're
that
dedicated.
freshmen can be part of the Student Nurses Association.
That's funny. I just asked her this weekend. I saw a post on social media and I was going to repost it, but it said something about pre-nursing
Mhm.
students. And I said, let me fact check this real quick.
Listen, when I was pre-nursing, that's all I thought about was being in nursing school. So any way that I was like, let me
awesome
try
to
to
know.
figure
Let
this
me get
out.
deeper down the rabbit hole.
I mean, I came to college knowing what I wanted to do, that which
Yeah.
makes a difference because some people have no idea what they
I
want
wanted to
do.
be a stockbroker.
Yes, I remember you saying that. Well, I just knew that I wanted. I mean, that's all I ever thought about. Like me and my friend, I was like, this is what I'm coming to college to do, and so that was my only focus.
That's so
That's awesome.
cool.
So did you find out as a freshman you could be part of SNA?
Oh no, I didn't. I didn't know. I thought the nursing building was this mystical, separate part of campus.
That's what most people
that
think.
was like. You're not allowed to go over there unless you're a nursing student.
Yeah, you have to be accepted.
Yeah,
The doors will not
Yeah.
open.
yeah. Literally,
You will
that's what
They
it felt
scan
like.
your eyeballs.
Yes.
Thrown out of the building.
I felt like if I walked in there, everybody immediately knows, wow, she's not a nursing student.
Well, you'll be excited to hear Kennedy and I are both teaching U101 classes, and hers is solely pre-nursing U101
nursing
class.
They
building.
will love you so
Yes.
much.
I love them already.
I met my class today, and I think I have 5 pre-nursing students.
Wow.
So I kept saying, come on over
Yeah.
anytime.
Yeah,
If
that's
you want to
good.
meet anybody, I'll introduce you.
Yeah, so we're
so
getting
that's
them in the building,
huge.
hopefully. So it's exciting to hear you say that as a
Yeah,
freshman.
no, I
That's
was.
That's cool. Yay!
Yes.
And this is why we're doing it.
Yeah. So we have some questions to kind of kick things off. I want to hear all the things. So first and foremost, congratulations! You passed the dreaded NCLEX. You did it. So
Hallelujah!
I am curious, what was that feeling like when you got your results that you passed?
Wait, I have to ask this question.
She always does this.
You were like so
So-
into it.
Oh.
Wait,
How many questions did you answer?
85.
Same as you.
Close, yeah.
You answered.
I was right under 80, yeah.
okay.
I thought 85 is the minimum. Well, it's
75
75.
was for us. It may have changed.
85 was the minimum for us.
Okay.
Oh, okay, so she's
see,
smart.
75 was the minimum when I took it.
Okay, so that question could have waited.
I was
And-
wondering, and I was like, wait.
Yeah, could have waited. Thanks.
I don't know. But
Um,
I have to pull it up.
So back to what I was saying. What was that initial feeling like when you saw that you passed the NCLEX?
Well, I had overthought about it so much that it was kind of just like numb, like relief. And I
Yeah.
mean, I was so excited, obviously. I was like, okay, confirmation of all of my thoughts. But
Yeah.
calling everybody that I knew.
So did
That was
you
my
know
feeling.
it?
Call
'Cause,
everybody.
you know, we've heard the trick, and I don't think
No.
you can do it anymore. You can't do the trick to go back
Oh, you
and see if
can.
you
Don't.
re-enroll.
Don't do it.
Have you heard of
Why?
people getting like false hopes?
Yes. So many people have like falls failed and like they're like, oh my gosh, I failed. And
Oh my gosh.
I don't know. I hardly remember like the actual motions of going through the trick or whatever that you
Right.
can. But oh my word, I did not do it. Like I didn't do the trick, but we read about it because
Yeah.
obviously I was sitting there and I was like, my life is over. Right after I took it, I was like, this is the end. And
had
I
no idea
convinced
that could
myself
happen.
it's so tempting to try every single thing possible.
So
to see if
how
you
long is
pass.
the turnaround for you? How long until you find
Oh,
out?
okay. I took it on a Friday, which was
Mhm.
probably the dumbest thing I could have done ever.
So,
But you have to wait till like I think
it-
I got it on a Sunday. Honestly, I can't
So
remember.
like
It's either
24,
tw-
48 hours.
It's at
Exactly,
least
that's what I
2
heard.
days.
Ah,
yeah.
so
Yeah.
that's different
On a
when you
weekend.
take boards. So I'm an F&P, and when you take boards for that, you find out at the end of your test, it pops up, passed or failed.
I wish.
Yeah.
Yeah.
Okay,
I
well,
have no
first of all,
idea.
you two have none to say because I had to wait 6 weeks.
That
For
sucks.
That's
my-
ridiculous.
I would simply
6
pass
weeks.
away.
Yeah.
I would
Uh-uh.
simply pass
Talk to the
away.
man. But then back then you could go and work at what's called as a GN.
Oh,
you
yeah, like a
still were
pre-
like in orientation. You were still
Oh.
acting as a
I
nurse.
think you can like get like a temporary license, but you have to
can.
pay
You
for
can.
it or something, right? Don't you have to pay for it?
I don't know
I-
about
I
that, but I
don't.
do know you can do a temp.
It's been a long time since
Yeah.
I've not been a nurse.
That's true.
Right.
So what was those first couple of days? What were those first couple of days after you found out you passed, you're gonna be a nurse,
Well,
you
what was-
finished school?
What was the first thing you did other than drive home? What did you do
I called everybody that I knew. I think
after the test? Or
Yeah.
after you found out?
after I both. I listen. I cannot mentally dump on myself. Like I can't. I have to talk.
That's
I
so true,
love
though.
that.
I
love
can't-
that.
I have to bring any people who don't like my friends who aren't even in nursing school, never even went to college.
You
I
totally
was
vented.
calling my friend, being like, "I need to tell you everything about this test.
Yeah.
I possibly remember."
It's so true. We've talked about that. You got to have your people
Yeah, no,
Yeah,
to
your
unload
village.
on.
We call it the village.
Mm-hmm.
Well, I was so scared.
So
Yeah,
did you
okay.
go get a milkshake or
I-
coffee?
I was. Oh my goodness, this is pulling up memories because honestly, I've tried to. I mean, maybe it's like a trauma blur.
Wait, this is new.
No, it's not.
You didn't have that in clinical with me.
Well,
No,
she's
but I
not allowed to
can't
wear it.
Oh,
You didn't know. I got married in nursing school.
oh, that's right, you did. My bad. I'm sorry.
It's okay. I think one of the second week of class. Yeah, it would have been the second week of actual nursing school when I first got in.
Oh, level
I
4?
announced to everybody that I was engaged. I
See,
was like-
she was were you
that's
part
how I
of
met
the-
my best friend, actually.
Who?
Haley Evans.
Yeah, they are.
Okay, good that you can confirm that.
She's like, yeah, they are.
Yeah,
Sorry.
she
Okay.
is.
They know you were doubting.
I
All right.
I clarified. I checked their socials.
I
They are
lied.
indeed
I lied about my
best
friendship.
friends.
Yes.
I had them both in clinical. That's all I'm saying.
Well, I announced to everybody, and I was like, they were like, "Oh, how was?" I forget who the professor was. They could probably listen to this and tell me who it was.
Fowley or model? They
I-
call level 4.
I think it might have been Fowley. Anyway, I was like, they were like, "How are you? How was your weekend?" I was like, "Oh, I got engaged."
You didn't go on a honeymoon? Oh, you got engaged. Okay. When did you stop it, Gabby? You know
I went on 2 honeymoons because I was in nursing school.
Love
Really,
it.
as you
Yes, as I should.
yeah.
I did that day that you have off, election day in November. That was the weekend that I got married.
Oh, cool.
So like I made it work. This
Those
is gonna be the whole time.
first-
Normal though. She's
So those first couple of days after you passed the NCLEX, what was your mindset like? What did you do?
I'm trying to honestly, it was hard to put the pieces together in my mind of what happened when, because I took the NCLEX at the end of or in the middle of February. I took it on.
Okay.
I think I actually took it.
So
on
you
Valentine's
waited.
Day. Yeah, I took it
You
on
waited a
Valentine's Day.
solid chunk of time, like
Yes,
not a
so you
little
but
bit longer than
to
the
be
6
fair,
weeks.
I didn't know you could take it sooner than that. I mean,
Okay.
people are. I don't know if it was just our cohort, but a lot of our people didn't take it until like I feel like it was
yeah,
later.
y'all did take it. Why was that?
It was because you have to do so much to like
Mhm.
get yourself signed up for the NCLEX, and it was like nobody knew the process. Nobody knew how to do
And
that.
I kind of feel like we as a school should be like at some point
like
towards the end of the semester
today's
say,
the day.
hey, we're
Go
all going to
sign up for
sign up.
Yes,
Or at
that
least
would have been
say,
very helpful.
hey, this is how you sign up. Show me. So I graduated in December as well, and I started my first job at the beginning of February. So you're
Oh
saying
yeah, no,
y'all waited to take till like mid-February.
yes, but I started my job 2 weeks later. Like
Okay,
I
so it
took
was
the
fast.
NCLEX and started
'Cause you had
February
it lined
28th. I
up.
think I started my job.
So
Yeah.
you had a job lined up.
Yes,
You took the NCLEX. You were good to
betting
go.
that I was gonna pass.
Hey, of course.
There you
You
go,
have
you
to bet on
should.
yourself. If you
You gotta
don't,
go
who
in
will?
positively.
How do you feel like, now that we just had that conversation,
Yeah.
how do you feel like your time at USC Aiken prepared you for the NCLEX?
For like the content of the
Yeah.
NCLEX. So probably the repetitiveness of answering questions on a computer is like that's what helped me, because I ended up getting Archer, like the NCLEX prep thing,
Mhm.
and that helped a lot.
Tell me more about Archer. What is Archer?
Archer's the NCLEX, like you can buy a however long a period of time, and it gives you NCLEX practice questions
On your phone.
on a computer. Yeah, whatever.
Okay.
Are you familiar with UWorld?
It's the same thing.
Same thing.
Yes.
Okay. Because that's what I did. So I was curious.
Yes,
Because that was
it's like the exact same thing.
so helpful.
Yep. Don't recommend taking NCLEX without one of those two things.
I read
Yes.
a book. I had a book with was like that thick.
Listen,
Had a book.
you're dating yourself.
No,
Yeah.
I always do. It's fine. I own these wrinkles. We
Um,
prepare, so our curriculum works.
Yeah. So I
Even
like
this
how
now.
I think everybody in our cohort passed.
I like how you mentioned doing your exams on a computer.
Yeah, handwritten is different.
It is so different.
You
and
wouldn't
I
believe
think,
how different it feels.
yeah, I think, like you said, practicing it's just second nature. By the time you go to the NCLEX is huge. I still did Scantrons when I was here, and then just had anxiety because it was on a computer.
Yeah.
When I took the
I can
NCLEX.
see
So
how that would
that's
be.
good to hear, because I think students get anxiety here taking them on computer.
Especially when they go from pre-nursing into the nursing program.
Yes. So I enjoy hearing that. I think that is great advice.
So including the select all that apply.
Yeah.
All of those helped prep you to
Yes. Yeah.
Yes. So the formula.
Yeah, there actually was not many on the NCLEX
Woohoo!
for a lot of us. Yeah, I talked to several people and they were like, I didn't get hardly any.
And see,
That's
this
good.
past cohort, we're hearing lots of case studies.
Oh my word, yes. There were so many case studies.
Okay,
It was
so-
just like it was like chunks of 8 like questions, which I don't remember like any of the questions, to
Right.
be honest with you, because it's just it's just there and gone. You only see
Yeah.
it once and it's
Probably
just
could
out
go
of your
back in that
head.
text and see what you told me.
Probably. I was texting, I was the first to take it actually out of a couple people. Or no, was I can't, it's literally so
Sure,
to
yeah,
remember
no, that's
when and when
okay.
I took-
Dramatic.
But I remember trying to talk through. I'm pretty sure I was the first out of my 2
Your little
closest
bubble.
friends, and it was just terrifying.
Yeah.
I was scared, honestly. The NCLEX was hard.
Yeah.
It
Well,
was-
just the anxiety associated with it alone, I think,
yes,
just amplifies.
right.
So when you
The
cut off
level
at
of it.
75, did you panic? Or
85.
Panic?
I sat there at question 84, or it was question 85, and I had, you Google everything under the sun about the NCLEX. Like, is it more likely that you passed if you get cut off at 85, or is it less likely that you passed
Did
if you
not
get?
know y'all were doing that.
Are you kidding? What? Like, what question means that you passed?
Yeah.
Because if it gives you more questions, then you think I'm still on the fence.
Yeah, I'm
Mhm.
not
But if it
confident
cuts
yet.
you off at 85, you
You're
either
either
know you
fail-
passed.
Smart or you real dumb?
Oh, yeah, exactly.
Real dumb.
So
Like, go
I
back
was
to
sitting there at question 85, and I took a mental moment because I was just trying to get through it. And I saw that it was question 85, and I was sitting there. I was like, this could be, I will break down. If I've lifted my hand off the mouse, and look at me. I can make it shake now, but like you sit there and you shake. This is because I've only had caffeine today. But
That's how you
I
just-
shook there.
okay.
I like literally just, because they record you, and I just like gently took my hand off the
Yeah.
mouse, and I was shaking so bad.
Now,
and
where
I
did you
told
take
myself-
it? Where do you take it?
I took mine in Augusta
Like
at
Sylvan or something? Like a
it was
learning?
like a weird,
Like a testing center.
looked like a hotel, to be honest.
Mm-hmm. It's kind
Yeah,
of sketchy.
and you have to park in a parking deck, or they're gonna tow you. They will tow you if you don't
Downtown?
park in that parking deck.
Well, it's downtown, man. Yeah,
Dang.
that's awful. All
Like,
right.
there was
well,
yeah, anyway.
Oh my God.
Congrats. 85
Good job. Good
questions.
job.
Amazing.
Look, I knew that. I knew she was going to be uber successful.
That's
She
good.
just
Oh.
never paid attention to me.
So
What? That's not true.
Did when I kept telling you, stop stressing. You know this. You know this.
Oh, well,
that's
that's
just
just a
general
part of being
advice
a
that we're
nursing
gonna
I
start
know.
off.
student. I
Yeah.
don't know what you want me to do about that.
I know. I'm feeling it.
Yeah.
Feeling it.
So passing the NCLEX is one thing, but walking into your first real nursing job is totally different. Am I right?
Yeah,
Yeah.
for sure.
So tell us where
So-
you're working. I'm getting asked that question.
Okay, yeah.
Where are you working?
I work in the NICU at Piedmont in Augusta.
That's where she wanted.
So
It
that was
is.
your first
NICU.
pick.
Yes.
Yay.
She wanted NICU.
What surprised you most about your first few weeks on the job?
How much I hated night shift.
Really?
For sure. How much
So
I hated night shift.
Are you still on nights?
No, I'm on days.
How long did it take you to get from nights to days?
8 weeks.
8 weeks.
That's
Because
it?
I'm still going back to nights. So they have me training on days for 6 months.
Okay.
Because everything happens mostly during the day, like doctors rounding and
Right.
everything. And because I'm a new grad, there was 3 new grads hired, and we're all from different schools, but they want us 6 months on days to learn doctors rounding and the things that happen during the day. That way, when they transition us to nights and then they pull the current night shift nurses to days that are on the day shift wait list, that they're not just dumping new grads into night shift and
That's
overloading.
very smart.
So
you're
we're
gonna
getting days for 6 months, yeah.
So 6 months. You did 8 weeks at night.
And then you go to days for 6 months.
6
yeah.
months. Huge. What advice would you tell someone that gets less of an orientation than 6 months? Because I got 6 months going into the
Oh,
ER.
I'm not on orientation anymore.
Oh, you're
I
not?
got 16 weeks of actual orientation, and then I
And
came off.
That's the
Oh.
most. That's
Mm.
the
That's
most.
the most you can get. Is typical for ICUs, I think.
Mhm.
But
Well, NICU.
At that facility.
yeah, well, in the NICU, and I think labor and delivery also does 16 weeks potentially
There's
at
so
Piedmont.
many different areas to labor
Mhm.
and delivery. She's L&D.
Mhm.
But she teaches maternal health.
Very
Oh.
cool. So is it across the board 16 weeks for everybody? Okay,
No,
so for someone
mostly
that gets
12.
less
No,
than that,
I mean some people got
it's short, like 6 weeks.
Yeah.
Please tell me no.
So what advice
People got
would
put into 6 weeks,
Are
and
you
I was
serious?
like, I would have simply passed away. I
Yeah.
wouldn't have made it.
What area were they?
Probably med surge. I know that I think ER gets 8 weeks.
What?
8 or 10 weeks. I think they got 10.
That's the dumbest thing I've ever heard. I had
Okay,
6 months as a new grad in the ER.
The pain's coming back in my eye.
Okay, so knowing your experience having an extended
Yes.
orientation period, what advice would you give to someone who's told you only get 6 weeks of orientation as a new grad? What would you tell them to do?
You either need to ask for more, which is a very easy way to get out of that, because they probably will have to give it to you. I really don't see how they could say no. Like, honestly, I didn't have that situation, but I feel like there's no way. But the pressure probably is so high to be like, I can do this. Okay, this
Yeah.
is how much time they gave me to do this, so I must be able to do
So
this.
you're putting pressure on yourself.
Yeah,
not
I can see
the-
how you would. I felt ready to come off of orientation. Like 16 weeks was like just perfect amount of time for me. It was to the point where I was like, okay, I'm so tired of having somebody look over my shoulder all the time. I know how to do this.
Yeah.
So have you done a UVC yet? Have you put in a UVC catheter yet?
We don't do that. Nurse practitioners do.
Mm-hmm.
Put them in. We can
that's
take them
true.
out.
Mm-hmm.
We can take out a UVC.
Are you hanging prostaglandins? There you go. Have you hung that yet?
Yes, I have.
And every time you hang it, who do you think of?
You,
Thank you. That was the right answer.
Oh my
Who
gosh.
told you that?
you did.
Thank you.
You did.
Just putting that out there
Yeah.
in the universe.
You're amazing. Everyone, Kennedy's amazing.
Yeah,
Kennedy's amazing.
I don't think they.
She's incredible.
You might not know it now, but she's amazing.
You should know it now because get it in your head.
Yeah.
I'm not
Yeah.
kidding.
Says-
Best teacher ever.
Oh, you make me cry. Make me cry as I fall into things all the time.
Yeah, fall.
I
Yeah.
fall all the time.
She's a accident prone.
I remember when you came in the one day and you were
Mm-hmm.
laying on the floor and you were like having some kind of stomach problem.
Oh yeah.
Oh, at clinical in the hospital.
Oh
in the-
yeah. They were a great group.
I love it.
Mm.
So your first day on the job, what were you most anxious about?
Very the first day, I mean the first night.
Yeah.
I started on nights. I was just numb. I feel like I wasn't myself at all.
Really?
I know. I was so eager to be like, yay, I'm gonna come in and be this awesome. Like, they're gonna want to work with me. I'm gonna be great. I was so quiet. I probably stared at people. I was probably like,
Feel like a baby deer.
I mean, I felt ready because I had done my practicum there, and
Oh,
I
cool.
felt a little confident.
Okay, so let's talk about that. So you did not get cheated your hours, and you got that. You remember because we had the whole discussion about the contract and stuff. You remember?
Oh, you mean like getting shorted on orientation? Yeah, no, that wasn't even an option. I
Awesome.
don't think they would have allowed it
That
even
makes me feel
because
so much
they
better.
wanted me to have more
Good,
orientation.
yeah.
Yeah.
How was your anxiety different on that first day versus first day off of orientation?
On that first day.
So first day as a new grad, you just graduated, you're
Oh.
coming to
Walked
work
in
at
the door,
night shift.
first
Oh,
shift.
so
Now,
different. So
how was your
different.
anxiety different coming off off of
Orientation, I
orientation?
was like, get me out of this. Like, I was like, please, I don't want to be sitting and sharing a computer with somebody because in the NICU, you got 2 computers. And
Oh my gosh.
you're at the nurse's station in the middle and you had to share the whole night. So it's like, I feel like I didn't have a mental break. And walking in, I don't know if we're getting to walking into a new job, like if that's a part of this question
don't
or
know.
not, but it was just terrifying. Like, probably the most just I felt so separated from, like, real world, and because it was night shift, I was away from my husband, I live an hour away.
Oh my
It was a
gosh.
brand new job, brand new people. I was actually, gonna be the nurse that time, and y it was so different.
Alone.
Even though orientation, I was on nights, and I was in the NICU, that NICU, it was still like, "Oh, crap, whatever."
Now, how many
What was
beds?
going
How
on?
many beds are over there?
I think it's a 40 bed, but we don't nearly fill 40
Wow, I didn't
ever.
realize
We
it was that big.
I think we go on diversion at like 20.
Okay.
Wow.
Okay. Good to know.
So I know you said you did a preceptorship and you went straight into that unit. What made you want to be a NICU nurse?
Literally everything. It was
Other
like
than Kennedy.
It
I'm
didn't
just
start with
kidding.
me. She wanted it before.
I didn't want okay, I love the girls in labor and delivery, just a whole separate beast. Like, and then even postpartum, whole separate beast. I did not want to I wanted ICU or ER. That
Okay.
was my
Critical care. Yeah.
yes. I really like being on the spot, like thinking for myself and like making those decisions.
Sure.
I guess that probably is because I like control and I like to be able to like, okay, let's make this, let's do this.
I like that.
And so it just made me really and then I love kids. So I was like, okay, my first choice would have been pediatric ER, but I did one rotation when we were doing clinical in the pediatric ER. And at that point I thought I loved it, but when I got in the NICU I realized just how different that was and I just I don't think ER is for me. I
Yeah,
definitely think ICU is.
She was one of those students that I would have to go. It's time to go to lunch, Gabby.
I love
It's
it.
we gotta all get off
Step
the floor.
away.
Yeah.
Not during the med-surg clinicals.
No.
Let's be very clear.
So what would you tell
me off the unit.
someone that is still trying to figure it out? Maybe they're coming up upon graduation and they're still kind of, well, I like this, or maybe the ER, or maybe critical care, or maybe med-surg, I'm really not sure. What advice would you give them to help figure that out?
You really have I mean, if you have not done any clinical time in a specific area, I absolutely don't think you should just be like, that's what I want to do
Okay.
Yeah.
and not have tried it.
Be
Yeah.
open.
Yeah, you need to really think about your experience and what you've like witnessed, I guess.
Yeah.
Like your time in clinical, it like on the unit, like the actual hands-on work. I'm not talking about the atmosphere of
Yeah.
the unit, like specifically the job, you have to like it. You should be able to enjoy it in some way, shape, or
Love it.
form. You can't hate your job.
That's
So
awesome.
this is probably a stupid question, and I think I know your answer, but would you advise new graduates to start in med-surg?
That's really tricky because med-surg has its I mean, I have like so everybody says this too, but you're gonna be so well-rounded.
Yeah.
Like, I can tell you for a fact that I do not know how to do a lot of stuff that I learned in nursing school
Yes.
because I am in a very specialized
You
unit.
are. You
And
are.
I don't know if I will ever be able to get that back
Those
unless I
skills do
purposefully
not translate.
yeah,
No.
it is very different. I mean, I've had to do in and out caths on a baby.
Yeah.
But it's so different.
And you can see them like in and out house. Never mind.
Well, I
was
think
that's a
And
little
that-
that's a little
I think med-surg maybe should be viewed as its own specialty.
I think
Yeah,
it.
for sure.
I think it has its own like massive specialty skills, and that
Yeah.
is time management,
It's
organization,
different.
and you got to be able to pick up on everything. It's like working in the ER.
Yeah.
Exactly. I was gonna say
Yes.
that.
It's like
Those
working
two go
in the
hand
ER.
in hand. ER is a lot of it's just faster.
Yeah.
Like there's a terrible quote, but it's treat 'em and street 'em. Like
Yeah.
get 'em out.
Well, no, it's accurate. We both
Yeah.
worked in the ER at some point in our career. It's accurate. We don't like people when they start talking to us.
Right.
They got to either go to the floor
And
or
there
go
are
home.
some nurses who like we have a new grad residency at the hospital with new grads from different areas.
Right.
And we go there once a month and we talk about our experiences so far. And one of the ER nurses, she's like, I hate that I don't get to connect with my patients. Like
Yeah.
they're so fast in and out that it's like, if you don't like to get deep into stuff with people, maybe ER is for you. Maybe you're not the social butterfly and you want to chit chat.
Mhm.
Ain't nobody got time for chit chat.
Ain't nobody got time.
That would be more of like if you like that aspect, but you also like that skill set, and if that's
Right.
what you like, maybe med-surg is for you, where you can actually get a relationship with your patient, and you can get to know your ins and outs. It's more of a system in
Mhm.
med-surg. It's not as like you have to make decisions in
Right.
the ER. It's like I think I cried the most during those clinicals. It was
See, that was me and
awful.
Peds.
Were you at East Central?
I was at
I cried
Aurora.
every day.
You were
I was at
so you were
Aurora.
at the
No,
Kumbaya
psych
place. You weren't
psych
even
was
at East
just
Central.
an XO. No, I don't know what that means. XO. No.
But I think that's huge to take away and know that about yourself.
Yeah, it was
That you start a job that you love. I think that's really
and
cool.
there are some girls who are like, psych is for me. I'm like, you go.
Right.
Meet those people.
Yes.
Like I've never been more encouraging than to somebody who wants to be a psych nurse, but I will never do it.
It reminds me of you so much.
Oh, I love
Yeah,
it.
Yay.
How did it feel? May I ask one question?
No.
Okay, doing it anyway. How did it feel? What color scrubs are you wearing now?
A Navy.
So how did it feel when you put those on and your name badge and
Ooh.
it said RN?
Ooh.
Was it good?
Yes.
Was it good?
I love it.
It's so worth
Even though I still
everything.
felt like a student because I was orienting, I was like, look at me.
Yeah.
Look at this. I feel like a rich girl.
Look at
I have
this.
my figs.
Look at my pennies in my bank account.
Dollar.
Yes.
We don't have to eat at Chick-fil-A. We can go to,
I
steak.
pretend that my tea from Elevate, shout out, I'm a sponsor.
Oh, yes.
Yes, I'm a sponsor. I think I cut off myself before because I got so excited about it. But I was going to say, I pretend that my sweet treat, like my tea, is
Yeah.
my like parking pass. Like I don't have to pay for parking. But
There you
that
go.
is my parking.
There you go. There you go. I love it. I'm so excited.
Well, I
I'm
have
so proud of y'all.
one more question in this segment. Do you think your clinical rotations in this program prepared you and helped you decide where you wanted to go?
Yes, for sure. Deciding where I wanted to go because I would have had no clue what anything was like
Sure.
at all. Like it was just so. Even doing that one. Like, I think it was a half a day in the
Mhm.
pediatric ER. Like, that was just enough for me to be like, maybe not.
Yeah, because we were doing 12 hours.
And I didn't see a single patient
Yeah,
because
no.
they didn't have
Slow.
anybody.
It was slow. And
It was just a
it's
slow
either
day.
feast or famine. Yeah.
I think they had one psych patient, and I was like, wow, isn't that a sign?
Yeah.
That's a sign.
Didn't you graduate with Heidi
Yes, I did.
Okay.
Oh, wait.
Geisling? No.
No, she didn't do the
graduated with
summer.
Okay.
Yeah.
So I was telling someone about Aiken, the ER. I'm like, it's either feast or famine. I said, but when it's feast, it's feast. And
It is.
she
It's
just texted
honestly-
me. She's like, I did not take you seriously because for real, it got real. And she ended up putting in an IO.
Oh my gosh. That's
I
an
know.
experience. First
I
IO.
know. So it's awesome.
Okay,
Awesome.
I'm going to tap you just a second. Okay, I just wanted to make sure.
All right. See, I don't sound very loud, but that's okay.
Okay.
All right, so we're gonna have some fun. Not
Hit
that
it.
we haven't already been fun. We do this little rapid fire section called stethoscope hot takes,
Oh,
not hot dates, like I heard the first
Oh,
one. Hot
oh.
takes.
Takes.
So
okay.
first thing that rolls out of your
All
brain.
right, I got it.
Rolls out of your brain. What's your go-to self-care ritual after a rough shift?
Sleep and eat.
Nice. How long do you sleep?
Hopefully more than 7 hours, but hopefully more than 6 hours. On night shift, forget it. just kiss your sleep goodbye.
Accurate. Which type of patient care task is secretly your least favorite?
This is so weird because I'm in the NICU.
And
But
y'all do have different
doing
tests.
girths, it is so inaccurate, it's so unhelpful, and I just
Abdominal
can't
girth.
stand it. You just have to take a little, like, literally, it's just a paper measuring tape, and you have to wrap it around their abdomen.
And you're worried about cutting them.
And it's just like, I can't stand that part. I'm like, this is just the worst. Why do I have to do this? This is pointless. It doesn't help anybody.
There you
All
go.
right. If your first month as a nurse were a meme, what would it be?
The dog that's in a room burning that says, I'm fine.
I love that.
I'm not kidding. It was awful. I felt
Dog
like
in a room burning. I'm fine.
with the
I got
coffee
it.
cup staring like they haven't had sleep. I'm fine.
Hold on, I gotta pull this up. Can we pause just a second? I don't.
Oh my god, that one.
Dog
Huh?
burning meme.
Dog
We
burning.
gotta figure out how to like both pictures.
Oh yeah. Oh, that is a good one.
Okay,
And
yeah.
it-
I'll
That's
get
This
it.
is fun.
hilarious.
This
Yeah,
is
this
fine.
is fun. I got
It's
it.
fine.
I got it.
We're good.
And her eyes are big.
Nobody look.
All right. What's the most random piece of advice that's actually helped you that you've done?
You like nursing, like that's nursing advice, like
anything.
clinical advice or
It don't
just
matter.
advice.
Yeah,
Advice.
You don't have to stay somewhere if you don't want to.
There you
Yes.
You
There
do
you
not.
go.
You do not have to feel stuck.
go.
For
There you
sure.
go.
Oh, I love that.
Get a different
Finish
job.
these sentences. Get a dog.
No, get a
Uh,
different job.
Get a.
I already got a dog.
I get another. All right. Finish the sentence. My nursing school taught me.
My nursing school taught me the basics.
Okay.
'Kay.
I think that's the point.
My job has taught me.
Everything else.
Yes.
The blanks are complete.
I
complete.
love it. Man, you killed that. That was good.
Oh.
That was good. You came prepared. She understood the assignment.
She understood this.
I
She ain't
did.
burning in a room right now.
Nope, no dog burning
I've
anymore.
tried not to.
So one of the biggest challenges new nurses face is balance. Figuring out how to give your patients 100% of yourself and yet still having something left for you. So I have some questions for you. Still in your first year, wrapping up that first year. How do you balance work and your personal life now?
I really try to separate it like as much as I possibly can, like to a point where I will call my husband and be like, talk about something other than my job
Yeah.
for the rest of the
good
day.
call.
I don't want to talk about my day. I don't want to talk about anything. I don't want to think about my job. I'm already there for 12 and a half hours.
For sure.
Because it is not just 12 hours.
Never.
Thank you.
It's never
Never.
just
And
12
then
hours.
you
It's
add
12 and a half.
Your travel
At
time
least.
too.
And my travel time makes it a 14-hour job. It's a 14-hour day. It is. I'm moving closer soon,
Okay.
Yeah.
but
Y'all bought a house.
we did buy a house. Yes, thank you. It's
Congrats.
actually like 5 minutes from here. So
Great.
You can come hang out anytime.
yeah, it's
We'll go
like
get Elevate.
over towards yes.
You got it, girl.
We are renovating queen.
Whoop, 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 whoop. Love it.
Oh my God. Never realized it until I'm sitting between the two of you.
You
You're like,
raised
which
us.
way do I look?
This is your doing.
Yeah.
You raised us.
Y'all are scaring me. How is that balance different now than when you were in nursing school?
Nursing school felt like my day-to-day life. Like I didn't have to separate going home and going to school. I felt like nursing school would always transfer because I just felt like, it's on your mind 24/7. You're
Mhm.
constantly studying. You're constantly talking about it with your friends because you make the best friends here. You're always, especially if you're on campus. Like I wasn't even on campus and I felt like that.
Yeah.
Like unless I
Aw.
had like,
I was the same.
I'd go to church on Sunday and that's, and I would have like, family events and travel and vacation, whatever. But like if you're on campus, it does not separate. Like going to work and going home from work is different than it feels like two separate lives then.
Yeah.
So-
Oh, that's a good point.
Were
So-
you prepared for that? Like, did you
No,
see that
no,
coming?
That was my biggest, that was the biggest challenge that I had. It just all hit me at once when I started my job. It was the fact that I was separate from my home and it was not something that I could even take home. Like it was, all you could do is talk about it and then stress about going to work the next day. And I also hated night shift and I was losing sleep and it was just so
Adjustment.
Snowball.
much. Yes, it was a snowball effect for sure. I didn't know anybody. It was like
Did you find yourself a little bit bored because you didn't have to study or do ATI remediation or
Before I got my job, yes. Like, before, like, in that little transition period where I was waiting to start,
Mm.
I mean, even while, like, right after we graduated, like, January and February, I was begging to start my job. I was like, "Oh my gosh, what do I do with myself?
But
I've cleaned my bathroom 5 times today. I don't understand."
wish I had known. I
Yeah.
would have given you a key.
I was never more fit in my life than when those 2 months. Like, I
Really?
was at the
Love
gym
it.
4 times a week. I was bored. I was like, "Wow, gym is fun." I started my job, I haven't been.
So I'm curious. So you said you weren't really prepared for that
Life.
difference in
It was
work
like,
life balance, work
oh
being
my
school
gosh.
sometimes.
Yes.
How did that balance change once you started your job versus now? How did you juggle it differently? Or at what point maybe did you say, I need to juggle this differently?
It was honestly, I personally struggled so badly with night shift. Like, when I tell this is probably not normal for most people because I had done night shift as my practicum, but it was only like 1 day a week,
Right.
maybe.
Mm-hmm.
And you
And
could
so it
fit
was
into
something that I was excited for, and it was in the place that I wanted, so I was, like, really excited for it. Um, and then it was, like, personally, I had went through depression and everything. It
Yeah.
was just a really rough time for me.
Okay.
So my whole goal was getting to day shift in after that 8 weeks, and I think once I got off of night shift, I got some sleep.
Yeah.
Yeah, it's important.
And that could be a vacation too. I mean, honestly, took a week. If you take a week or something like that, just get away from it
Mhm.
because it was all so much. And I had been looking forward to that for so long.
Yeah.
And I thought it was going to be awful forever. And I got to day shift and I was like, I literally love this job. What was wrong with me?
So when you go back to night shift, how do
What's
you
the
feel?
I have a very different perspective, and I know that night shift is a part of nursing, and I'm gonna live closer. It's gonna be like I'm making it to be a better thing.
Good.
You know, it's perspective because I was just, and I felt really bad because I feel like it all just hit me at once. So I have a different mindset going back into
No,
night shift. I'm like, I
I
think it's
think
gonna be okay.
I think it's a perfectly normal mindset if you
Mhm.
ask me.
Yeah,
It's
I crashed out hard. But
I
it
mean, we
was,
learn about circadian rhythms and they're
oh,
real.
it's so
They're
real.
real.
I could not get used to it as much as I was like, "Okay, maybe I'm just not sleeping right, or maybe I need to do." I mean, I had the blackout curtains, I had everything, I had noise, and I did sleep. Like, it wasn't hard
Right.
for me to sleep.
Every morning I would throw up at 4 a.m.
Oh, yeah.
God.
I believe
Every
you.
morning.
I
'Cause my
absolutely believe you.
circadian rhythms do not allow for that. You know, I'm a 10 to 2 girl.
Yes.
10 a.m. to 2. That's all I want to work.
I don't mind, like, a 12-hour shift, I'm actually all for it. Like, I would much rather work 3 or
3 12s.
4 12s. Honestly,
Mm.
I put in a 60-hour week last week
Okay.
Oh my gosh.
because I'm
just-
on days.
We just
Yeah.
had this conversation about working too much.
Well, she seems to be self-aware.
Yeah.
I
Yes,
am
she
very
is.
self-aware of I was like, it just felt so wrong at first. I
Yeah.
was like, this is wrong. Something is wrong.
So she's leading into the routines and boundaries
Yeah.
you have to set for yourself.
Yes.
Well, I appreciate you sharing that
Yeah.
because I think this is what the podcast is about,
Yeah.
is sharing reality of
Yeah,
nursing.
the reality.
It's not
And
just
the first job, that first year, it's tough.
It's
And you have to
scary.
learn a lot about yourself.
Yes, it is very, like, I learned more about myself in those 8 weeks about, like, what I valued, where my time needed to be spent.
Yeah.
I thought I could run on no sleep. Like, before I started night shift, I was like, I am, I could do all night long. That first night, I was like, okay, I can do this. And
I
then the
can do
next
it.
night, it was like, I'm gonna use my lunch break to take a nap.
Oh, yeah,
Yeah.
done that before. Yeah, so I think everyone everyone thinks that when you graduate and you go into your first job, it's all happy, happy, joy, joy, and it's not
Not
always.
happy, happy, joy, joy.
A
No,
lo- you
there
know,
was no happy, happy, joy,
It's
joy.
adjusting because you are no one else up until this point. Someone else has always been the ultimate person responsible for that patient, and now it's you.
Right. That was. It didn't really hit me until closer to the end of my orientation that I would be alone like that, because orientation was a lot of just people checking over you, which I'm grateful for. They need to do that. But it was like oh my goodness. And then when you get off of orientation, and then I went to day shift and they still saw me as a new grad. So it was kind of like oh, do you know how to do this? I'm like, yeah,
Yeah.
I've been here for like 2 months. And I did my practicum here. Yes, I know how to put Aquaphor on the butt. Like, I can do it. I got it.
Yes, I can do it.
Think I'm fine. Go. Leave.
I love that because I'm the opposite. I would be like, no, I don't. I'm new here.
No idea.
Please protect me. I'm so scared. So yeah.
Oh my god.
Yeah, I love that.
That was her in clinical though too. There was
Like-
nothing you wouldn't tackle. You'd be like,
That's
I've done
cool.
it, but I'll do it. It's fine. I got it. I got it.
That's cool. I love
I
that.
just wanted to look good.
You did.
I just wanted to be the like. I
I just wanted
know
to come back because I knew
That's
there
the
was going to
thing
be a
with me, though.
podcast.
I just want to know things. Like, I don't want to learn them. I want to already have known them. Like, I want to be able to do it and be like, yes, I know how to do that.
And you know the
You don't have
reason
to help
why
me?
you're doing
Got it.
that.
Thank you. It's mine. Thanks. Bye.
I love that.
Because you gotta learn it,
That's
baby.
great.
You gotta go through the motions. You gotta build that muscle
Yes.
memory.
Yes, you do. Muscle memory's huge. It's like a repetitive thing.
Yeah.
Mm-hmm.
It's taking tests on a computer the entire time. It's called
Mhm.
muscle memory.
Yes.
There's a reason. So what's my favorite question I ask everybody in clinical all the time? What did I always ask?
Oh my
y'all?
gosh, I know it, but I don't.
It's one word, 3 letters. Why?
Oh, I was gonna say that because that's the only thing that's 3 letters. That's a question. Yeah. Or
I'm
how.
glad to know I
maybe.
made such an impression.
It's internalized. It's just part
Yeah.
of her now. She doesn't even
But
have
I
to think
love
about
I
it.
love that you're you have that that you realize that because it is important. You gotta and I love that you said that. And I say this to Claire all the time. You gotta take a week or just take some time and just
Yeah.
not do it because you will get burned out.
Yeah. It was it wasn't like a break of work. Like, I haven't had a my first vacation is going to be in October. But even just going to day shift and getting back into my routine, quote unquote,
Mhm.
like with, being awake during the day,
You know that thing.
And
I
seeing your
needed it
husband-
so badly, and I didn't realize how badly I needed it. I was to the point where I thought that this job wasn't for me. I was like,
Mhm.
maybe being a nurse, maybe I just can't do
Oh no.
It was just everything was crashing. And I was like, I started looking at other I was like, that's why I interviewed at a esthetician's office. So I was
Mhm.
like looking for a 9 to 5. I was like, maybe I just will never ever be.
Yeah.
Come to find out I like 12 hours and I like 3 days a week. And I
Mhm.
like the NICU
That's
so much that I
valuable,
don't want to
though.
leave, even though I got
That is-
offered a job.
So what made you decide that you didn't want the 9 to 5?
The fact that it was 5 days a week. I didn't want. It was so difficult because honestly, well, okay, what truly made me not want it was because I felt like my values were not going to be executed
Mhm.
doing something like
Aesthetics.
that. Yeah. It's just not, I was not passionate about it whatsoever. It was just going to be for the hours, no holidays, and the hours and no holidays. And it was soft. And I thought, that's a great job to have. I probably could still do it. And the mental stress would just be thrown out the window.
I can
Yeah.
do that PRN.
You should
I'll
get
have
that
time.
discount.
And
Yeah, I do need that discount.
So that leads into the next question. You've dived a little bit into it, but I'm curious, do you have any specific routines or absolute boundaries that allow you to recharge?
like after work or just
Anything. I mean, it can add up like you said, and it could be 2 weeks later that you're processing something. What do you do to keep going?
I have to talk about it so much that I can't talk about it anymore.
Okay.
And I have to get somebody, it's almost always my husband, who is like, we need to move on from this. Like, we just can't talk about
Sounds like
this
Daniel.
particular
It
thing
does
anymore.
sound like Daniel.
Or like, just not, we just can't, period. It's done. It's over. You can't change anything else about it. Because again, that control.
Uh-huh.
That control. It likes to take over. I'm
Yeah.
also very OCD.
Yeah.
Which is a part of being in the NICU, but
Sure.
to be honest, there is
you
some.
better be OCD.
Oh my word!
I'm
It's
just
like a
saying.
qualification to work there. It's
God.
I didn't
Add it to the
realize how
resume.
bad it was until I'm like, I won't make it if I don't cap that IV. I won't make it.
Oh,
That's
good.
so
I love to
funny.
hear
The
that.
little green caps. Oh
Oh,
my.
and the trash cans. Yeah.
Yeah.
No,
yeah.
that's like my OCD comes out so bad, and there are other nurses who you just don't get in their stuff. Like
Mhm.
there are
Yeah,
nurses
no,
who
I
it's
can
like,
see that in NICU.
and I really
Sure.
maybe that's why I was so. That's why I so love it so
Why
much
my
because it's
garden?
like, this is my area. This is my baby. Like, that's,
Yeah.
these are my babies.
So do you use your different color pens and
Oh,
stuff?
yes, ma'am.
They have a rainbow. They had a
The little
rain.
mini ones?
No.
Oh, I have
Oh,
mini rainbows.
They have they have very specialized. I remember y'all's papers.
How has nursing, after being in the field, changed your perspective on health for yourself and your loved ones?
A lot.
How so?
I have become a real, I mean, my husband is like a cowboy. Like, he'll pick up gum off the floor and eat. Like, and it's to a point where I'm in the hospital and I'm sitting there and we have to wipe down the whole NICU with like these bleach cancer-causing wipes
Yeah.
before every shift.
Do you wear gloves?
Yes.
Oh, see,
And
I never would put
like,
gloves on.
we have x-rays constantly. And so I'm like, I have become very like, how is this going to affect me in the future type deal?
Mm-hmm.
So I'm like, I know that everybody's like, I'll stay in the room for the x-ray, whatever. I'm like, I'm gonna step out. Yeah, give me that
My
lid. I'll
ovaries
take
will
that.
thank me in the future.
Yeah, exactly.
Mm-hmm.
So I'm like, yes, I will step out. Thank you.
Well, I don't have mine anymore, and I want them to radiate my thyroid so it'll work faster.
You're ridiculous.
And then in other ways, it's like, I get home and I'm like, I just want to relax in my own air.
In your
Mhm.
own air. So you've become a
Yes.
germaphobe, is what you're telling me. You and
I
your
was
OCD.
already kind of like clean my bathroom
I
5
mean,
times
she
on
said
break.
she's OCD, so.
Yeah. I mean, it makes
Yes.
sense. You can come be OCD in my house. You would lose your mind. No
I
problem.
cleaned houses for a side job in school. Like, it's just how I work.
Yeah, I
It's
really
just,
need you to come to my house.
Yeah,
now. Just sit
seriously.
down. Dang. Okay.
I'm a wedding coordinator on the side. The process is what gets me.
I love it.
Tempt me with a schedule.
Don't tempt
Love
me
it.
with a good time.
Don't test me with making a Excel spreadsheet. Love me some Excel. All right. What do you wish? All right. So now let's turn this into some advice for those students that are
Okay, yeah.
still trying to figure stuff out and they're still grinding it out in clinicals. What do you wish someone had told you before you had graduated?
Before I graduated, probably really just enjoy your time in nursing school, because I know it's hard and all you think about is passing, but it just is so different. You think it's going to be like, oh, it's going to be the same. It's just going to be a job. Like, no, it's definitely like a good time in college.
It
Like, it's
really
definitely
is.
like, oh, wow, those were my glory days. I was engaged. I was like learning what I wanted to do. I was with my friends every day, which is
Yeah.
huge. Like, I don't see my people nearly as much. And I'm like, that's so sad.
Yep, it is.
You know, I've never thought about that. That school, you legit get to hang out with your friends every
Every
single
day.
day.
And
You
my
go through
routine was like,
combat.
oh, let's go get lunch. And now it's like, we have to schedule lunch. And I'm like,
Yeah.
that's so
Yep.
boring.
I've never thought about
So
that.
great. That's great. And
Oh,
she's absolutely
And yet now
right.
I get to see my friends every day now. Yay!
Yay!
That's cute.
It's full
We
circle.
found that we lived in the same
It's
neighborhood.
full circle.
Oh, like, yeah, we lived in the same neighborhood.
Yeah.
Her office is right next to mine.
I can't get away from
She
her.
can't get away from me. I'd be like, help.
Save me, Gabby. Save me.
I know you said you did this
I'm gonna-
podcast by
I'm gonna
yourself.
give you a hand signal that I need help.
Like twice.
Yeah.
I'm gonna leave. Oh my god. Why are y'all ganging up on me?
Because we love you.
I know. Like I
It's
said,
okay.
I can handle it. It's fine.
Yeah, you can.
We had fun.
What advice, Gabby, do you have for nursing students that are preparing to take the NCLEX?
Do the U World or the Archer.
Take it fast.
Like take the test
Yeah.
pass.
Schedule it fast.
Oh yeah. Just do it. Like, just Nike. Just do it.
Maybe they'll sponsor.
I know. I was about to say,
NCLEX.
will they sponsor us?
Is there a sweet spot you think from
Mm.
graduation to
Like,
testing?
did you need a break, like mentally, and then at like
No.
week 2, I'm like, okay,
Take it.
Just take
just
it.
take it.
Just take it.
Okay.
I mean, I waited a month and a half.
Yeah.
So that was too much. I felt like, I was like, oh my goodness, please. But I wasn't going to start my job until the end of February. So I was like, I have time.
Yeah.
Yeah.
Did you
Also,
have a
Haley
backup
got
plan?
married. So
Oh,
we
yeah,
like
that's
had a little break in there, and I was, yeah.
When you're in the holidays too.
Yes. So
Yeah.
take your holidays.
And then just do it.
just take, I would say, at least 3 weeks to study.
Outside of the
again.
outside of the ATI course that you took with the school and Archer, did you do anything else?
No.
Beautiful.
Awesome.
Nope,
Enough
that was
So
it.
that was good.
Hard no. Beautiful.
Yep.
Awesome.
Those Archer, like, whatever, like, prepare you tests, they'll give you, like, you're likely to pass, you're very likely to pass. Those actually gave me so much confidence because I was like, as soon as I started passing those
Now
without
the
looking at
ATI?
anything.
Yes.
What would you say to a student who's doubting themselves?
That's important because just doubting, like, just any point in the program, you're just doubting yourself.
Yeah.
And that depends on, like, are you doubting yourself because you're failing or you're doubting yourself because you don't like clinicals or something? Nobody likes clinicals. So you're just going to have to get over it. Like, you're just going to have to move on because nobody likes them. Nobody enjoys it. That's not your basis
Yeah.
for whether or not you're going to thrive in this career. Like, it's not going to be like, oh my word, I don't like to wipe, but
I'm not gonna be a good nurse.
I am not cut out for that. No, that's not how it is.
Now, however, if you can't handle bodily fluids, I think that we have an issue there.
Yeah,
I
it
should-
depends on how much those gloves make you comfortable. Because if you can put on gloves and be like, ugh,
No, see,
run away.
someone who like really bad, you know, I'm talking about like bilious vomiting, and you haven't had that because you have babies. Like the
Yes, I have.
that is
For
the
well, let's just
oh God.
projectile vomiting. That's
Yeah.
a thing.
Well,
Projectile pooping. That's also a thing.
it's, and this is why I don't do Nikki babies. I can't. That I
You
used
should have
to
seen the
live with.
poop that was running down my leg
Oh my god.
when I was feeding a baby.
You wearing joggers?
I was wearing the jogger.
And
fake
did it get on
scrub.
your
Oh, it was
skin?
yellow. I stood up and I looked at my coworker and I was like, "Where are those labor and delivery scrubs?" And she looked at my leg. She's like, ugh. I set the baby down. I was like, "Somebody finish feeding that baby,
I'm
please. I'll be
done."
back." And I didn't touch anything. I felt so dirty.
Yeah, and you gotta stay like that for the rest of your life.
Yeah, it was not it.
All right.
Sorry, I don't know where we got on to
I don't know,
projectile
because
poop.
it's me.
Well, it sounds like you need to evaluate why you're feeling
Oh,
dumpy.
right.
Yeah.
Right, the student who's doubting themselves. If you are doubting yourself because you're failing and you genuinely cannot get this material and you don't think it's for you, cut yourself off before you drag out your agony. Like, if it's not like I want to be like, keep trying. But if it's not for you and you're like, you just don't like anything about this anymore, then you're probably not going to like it even when you're done with school. So I would just, use the classes that you have. Even if you're like, if you've just begun, especially, like, I would not prolong it and be like, oh, I chose this, now I have to do it.
Yeah.
But going back to that, you don't have to stay where you are. Like, even if you think you need a different career.
I think that's really smart advice to
is,
give
it
because
is.
I think
That's
people
like-
do tend to hang on and their parents expect them. that
Yes,
they're
like,
gonna
you're
end up in this
grasping at, like,
profession.
please. Like,
Yeah.
Barely getting
don't
80s.
prolong it. Just, just
Yeah.
choose it and then run with whatever else you choose.
There you go.
And even if you're like graduate or you're graduating and you have passed and you're doubting yourself as liking a nurse, you have no idea how many options there are for like
Yeah.
soft, quote unquote, soft nursing,
Yes.
or literally just something on the side that you're qualified for because you're
amazing.
qualified for a
Nursing.
lot.
I like that term.
I
soft
like that
nursing.
term. I like that term. But, there is really no soft nursing. You're
I
a
mean,
nurse.
true.
Yeah,
Yeah.
you're a nurse.
So there's a lot of push right now in recruitment and retention for our school.
Mhm.
So I hope that we have someone in high school or someone who's still trying to decide what to do with their life. If there's someone considering nursing, what would you tell them?
It's still on the fence.
Yeah.
What would you say to tip them
Well,
over?
if you're sitting on a fence and you're just trying to decide a career, like you have to jump on one side of the fence and run away from the fence.
That's beautiful though. I like it.
Because if you're going to choose nursing, choose it with all of yourself because it has to be all of your want. Like, you can't sit on the fence for the rest of nursing school.
No, you can't.
Or even in your prereqs. If you're coming out of high
I
school
like that.
and
I
you're like,
that.
I don't know if I want to go to college to be a nurse, I would really encourage people to walk into college being like, let me just pick something and go. Because
Yeah.
you're not going to be able to keep dippy-dopping around.
Yeah.
Like, pick nursing
That's my new
and go for it.
term.
Dippy dopping.
Dippy-dopping
Dippy
around.
dop you.
Dippy Dop you! Dippy Dop! Dippity Dop, Daniel! Daniel!
I'm sorry, Daniel. I apologize to her husband a lot.
Oh. Okay. And then
Uh,
if you don't, like, just don't regret it. Like, just be like, okay, no, that was going to be a fat no.
Commit.
Yep.
No
Commit.
regrets.
And it's the most rewarding career ever.
Ah,
That's why I didn't want to
Gabby, I love this.
I
leave my
love hearing
NICU
that.
job for I had the choice to leave my hospital job bedside,
Yeah.
ICU, high stress for a softer 9 to 5.
Yeah.
And I did not choose it because it is so morally rewarding where I work that I was way afraid to step away from that. I was like, will I feel
Aw.
useless if I step away from this? Probably.
Which will make a lot of 40-year-old women happy.
Right. And there's value in all
Or
of that.
men. Or men.
So
or
if
men.
that's where you find yourself being like, I am passionate about this, I want to make people look good, but you got to put it in with passion. You gotta get passionate about
Okay,
whatever you choose.
so if you watch the intro,
Oh.
which you better, I talk about that my decision to become a nurse was not any reason. Like I had no. Why did you want to be a nurse?
So I actually
could
have a
ask it
story.
at the
Some people don't, and they're just like, oh, I just chose it.
That's
Money.
me.
I have a person at my hospital in our new grad residency that I only became a nurse for the money. I'm like, good luck because taxes take all of it.
Yeah.
Wow.
Wow.
Anyway, I was in high school, and it was in 10th grade, and my sister was in the 12th grade. Oh, no, I'm sorry. 1 year back. I was in 9th grade. My sister was in 11th grade.
Okay.
And we were in the same high school, and she took an anatomy course because she was trying to decide what she wanted to do when she graduated. So she took this extracurricular anatomy course and hated it. And I would look through her book at home, and I would read some of the stuff, and I became really obsessed with it, and I really liked it. So I was like, I'm going to take this course. So in 10th grade, I actually wanted to be a marine biologist, which that was a hot moment in my life where I was like, I'm going to go to Charleston, and I'm going to work at the aquarium. I don't know why. I hate fish. I don't know why. But turns out I really just liked learning about anatomy. Like, I really liked learning about how the body worked and how, like, the ecosystems worked. I really liked that. And so I took the anatomy course, and then I was like, I'm going to be an EMT. I was no.
No, you're not.
No, I'm not. And then I was like, I'm just going to go to college and be a nurse. Why wouldn't I do that?
So you were passionate. So for me, it was a job I could always fall back on.
Well, this is true. My mom told me that. She's like, you can always fall back on that.
My mom told me, nurses marry doctors, and no, I didn't want that. But so, where was I going with this story?
Mm-hmm.
Oh, you're talking about passion. So I made the statement that I didn't realize how passionate I was about nursing until I finished school.
Yeah, for sure.
So,
I didn't realize how passionate about it I was until I wake up on days and I'm like, I actually want to go to work. That's so weird.
No, that's great.
I know, I love that.
I mean, for every other job that I've had coming up to this, it's kind of like, I
Don't want to go to
don't
work.
really want to go and make coffees.
The
I don't
day
really want
that
to go
you-
and clean.
The day that you don't get excited to go to work, find another area, or
Yeah.
if you're just sick,
I mean,
out.
if you can't just mentally convince yourself, like, it's a good thing to do, or, like, you're going to feel okay and you're going to make your money, and that's fine. If you can no longer justify why you're going to work, I feel like it's just like, oh,
It's
that's
time.
Yeah.
that's got to be,
Fall in and regroup.
yeah.
So if someone is sitting on the fence, would you say do something like an anatomy class?
Yes. I mean, if you're in high school, I would definitely say explore it and find out how, like, truly, like, don't just be interested in it because you want to be that person. Like, actually feel it out, because I know somebody who's just as passionate about being a hairstylist as I am about being a nurse.
Yeah.
Yeah,
And I could
probably
never
my
do that job.
hairstylist because she fusses at me when I use a different shampoo. She can tell when I use a different shampoo.
I mean, that's when you know they're good.
Yeah, I know.
Yes, I was just saying, because passion always shows. Like, you will always show if you like your job. It will be, people will be able to tell. So
Does anyone think I don't do I care about my job?
Oh, yes, you care about your job.
I love my
so
job.
much.
I love my
Almost too
job.
much.
It's so hard to see. I know. It's so crazy.
So hard.
So, I love seeing when students post like they pass and whatever, and I'm very, very conscientious. I see everyone go, of course I'm going to congratulate you, but I'm very conscientious about not saying I'm proud of you, because it's not that I'm not, but you earned it. I don't feel like I did.
Aw.
You did all the work. So when I see it, and then when I hear you come back and talk about how things that I taught you, I'm the one who taught you about Edison.
It's true.
It really does. I'm very proud. So you have just come such a long way. Even in it's only been a year since.
It's only been 7 months since
you
I
had
started
me.
my job.
But when you had me in peds,
yeah,
that's
yeah,
really
you're right. Yeah.
when I really got to know you. And it was summer.
Yes.
No, it was summer.
Yeah, I took P's in the summer.
Yeah, because you made me do that TikTok video.
Yeah, that was fun. I didn't know I was the one who did that.
Yeah,
like,
it was your idea.
I didn't know it was me.
It was your
But I
idea.
remember you just being like, it was so bad.
So you've come such a long way, and I literally, and my insides are like flipping like the inside of my brain, because I am so excited and happy for
Aww.
you. So let's talk about and I always hate these questions, but I'm going to
Okay.
ask them anyway. 'Cause
Okay.
I think you get them on interviews too. What are your short-term goals? What do you want to accomplish, like in the next 3 years or so?
In the next 3 years, I want to permanently be on days.
Okay.
Like, that's just a very superficial thing, but I don't want to do nights long term, personally. And there are nurses who thrive in that role, and I commend them, because I'm just not one of those people.
Mm-mm.
And I've tried. Sorry, go for it.
No, go ahead.
I was just saying, I've tried. Like, I think I've already given it a good hit, but, like, I will find a place where I could be on day shift.
Have they told you a time frame of how long that might happen?
No.
Yes. I mean, I know they haven't told me an actual time
But
frame.
because you rotate
When I
down.
started, and I put myself immediately, like, first day I put myself,
Oh,
I
yeah.
emailed and I said I'd like to be on the day shift wait list.
Yeah.
12th in line.
Oy.
12. That's 12 people who have to either quit or move on from days. And we have a smaller unit.
Mm-hmm.
It's at least 3 years. It would be at least 3 years, and I'm just not cut out for it.
And then when you do finally make number one on the list, and you're said, oh, well, you're too seasoned, I need you on night shift.
Oh, they won't do that, because I would be like, okay, well, either I go to days or I'm gone.
Yeah.
Okay, so let's think long term. Where do you see yourself long term?
Long term, I see myself having kids, working PRN in the job that I love on day shift.
Boom. Mic drop. I don't want to drop them because these are expensive, but mic
Or
drop.
part-time, but I think part-time.
PRN's better because you don't have to
PRN,
have a
I
holiday
think you get
commitment.
paid more.
Yeah.
You
Part-time,
get paid
you
more
don't get-
hourly, and you can schedule yourself.
Yeah, you don't have the
PRN
holiday
is the
commitment.
goal. I'm about to be that PRN princess. And I don't even care. I'm going to have my Starbucks and my baby. I'm going to be like, here I am, hot mom, working PRN. I'm serious.
Keigans
Yeah. Okay, all right. So how do you want to grow? How do you envision yourself growing from here? Because you're already learning so much.
Right.
So
You just
much.
never
Where do you
stop
go from here?
absorbing. Like, I've honestly, I'm still working out the work-life balance, because now I got a house and I feel like you need to get a hobby. That's a good advice. Listen very closely. Get a hobby. Get something to do with yourself.
What's your hobby?
My house. Like, I'm going over there after this to rip down a chimney. Like, I need something to do.
Oh, that's some good stuff,
That
because
is
you
good
get to
stuff.
beat something.
Anger management right there.
Right. I'm serious. I literally am going to use a sledgehammer.
Yeah.
Okay.
So,
I want to. It's been fun.
I know. This
I
is
missed
so fun. I feel like we
you.
could talk for forever about stuff.
I
Yeah.
know. I know.
well, I just want to thank you for coming back and sharing your story. I think
Yeah.
our listeners will find lots of value in what you
I
had
hope
to say.
so.
Run from the fence if you're not.
Yeah,
in
that
it.
I mean,
I
so
love that.
many tidbits to take from this
Love
this
that.
episode. So it's been such a gift for us to have you, and hold on, for us. Okay, it's been such a gift that you've come and shared everything with us, and given advice to future students, current nurses. So thank you for that.
You're welcome.
Yeah.
Of course.
So we're doing a series where students from the previous level come back and talk about their
Mhm.
experiences. So you were my first choice for coming back after graduating.
I'm
I didn't even
so
have to think
special.
about
Yeah,
that, did
she
I?
didn't even ask. I was
You
like,
guys
okay,
can't
sounds
even
good.
live up
Gabby's
to my
cool.
expectation.
I'm so proud of you. I hate using that word. I'm so excited for you.
You can say you're proud of me. I don't mind.
I didn't do it though.
Yeah.
You worked really hard,
And I appreciate that
because
because some people do say like, "Oh, I'm proud of you."
As always, follow us on Instagram at Pacer Nursing Power Hour and send us your nursing school wins, questions, or stories you'd like us to share. And you can listen us. You can listen to our podcast that drops every Wednesday on Apple Podcast, Spotify, and YouTube.
So we're Keigans and Kennedy, and this was Pacer Nursing Power Hour, where we learn boldly, care deeply, and transform health. Thanks for scrubbing in.